This supplement you take every night to sleep could cause you heart failure. Is this true? A new study is raising all the alarms. The news headlines pick it up, and fears arise as expected. Yes, we're talking about melatonin and the recent news linking it to heart failure. Is this possible? Can we no longer trust melatonin? Do you have to stop taking it? I'm Dr. Bora Bandera, a specialist in endocrinology and nutrition, and today we're analyzing the latest controversy. Melatonin is a nutritional supplement and neurohormone used by hundreds of millions worldwide, making it one of the most widely consumed supplements. You need to be alarmed, stay tuned, because I'll tell you all about it. In less than 12 minutes, you'll understand if it can really cause you heart problems and if you need to throw it away immediately, or if we're dealing with something very different. Let's get started. Heart failure means the heart muscle, your heart, fails to pump oxygenated blood properly to your tissues. It's a prevalent, highly symptomatic, and serious cardiovascular disease with high mortality, a major health issue. And it's completely normal to be worried if you read a headline like that and you don't have the training to interpret it properly. What's next? Creatine and pancreatic cancer. It creates widespread distrust in supplements. Let's review the controversial study. You'll learn a lot from it. The study in question is observational, it's not yet published, and it analyzes data from more than 130,000 international patients. It uses a fairly large database. These patients had a previous diagnosis of insomnia, and the researchers observed, I'll say this in all caps and with emphasis, what happened with these patients. Over a 5-year period, supposedly differentiating only by melatonin use, this observation was made retrospectively once that period of time had passed. And I say supposedly for the following reason. The active group included those who, per electronic medical records, used melatonin for at least 1 year. On the other hand, those who did not have melatonin use recorded in their history became the comparison group. Then, retrospectively, they looked at which diseases each group had developed. The results drew much attention. The first group, the melatonin group, had an incidence of heart failure of 4.6% during the study period. And the comparison group, the group without melatonin, had no incidence. In other words, out of every 100 people who took melatonin during the study period, 4.6 people developed heart failure. While in the group without melatonin, only 2.7 people out of 100 developed it, almost half. Additionally, the melatonin group faced triple the risk of heart failure, hospitalization, and higher overall mortality. These results have led to headlines like melatonin consumption doubles the risk of heart failure, or simply melatonin causes serious heart problems, which is very alarming. But what do we have to say about this on this channel? Well, quite a lot. Pay attention. I'm going to give you 5 counter-arguments. First, the study isn't published in any journal and therefore hasn't been reviewed by independent peer researchers. The famous peer review process, which you might have heard of. It's a conference poster that's going to be presented at the American Heart Association, like the ones we used to make in college for our final projects or during residency to present them at some conference. Careful, I'm not taking away its value, nor am I diminishing it. It's a huge effort, and any research deserves applause, but it needs to be properly put into context. You can't put it on the same level as a study published in Journal of the American Medical Association, for example. Second, it's an observational study that by definition, cannot establish a cause-effect relationship. And this means that any headline claiming melatonin causes risk or X is conceptually incorrect, whether for worse or for better. It can be said that in this study, melatonin consumption was associated with more cardiovascular problems. How we tell things in science matters a lot. Third, and even more importantly, in the comparison group without melatonin, those who took over-the-counter melatonin were not excluded, so the groups are not comparable. How can this be? This happens because only those who had melatonin prescribed as a medication were considered to be taking it. Here in Spain, for example, and in other countries, it's the same way. Melatonin can be either a medication or supplement, depending on the dose. As you know, everyone now takes melatonin since it's an over-the-counter supplement. You don't need anyone to prescribe it for you. You can find it in every store, in powder, gummy, capsule, tablet, whatever you can think of. Remember, these are insomnia patients, so most have taken melatonin at some point, since it's one of the first options or resources that patients turn to when they have insomnia, and not always prescribed by a doctor. I repeat, this makes them non-comparable groups because the effect of melatonin is not isolated. Fourth, severity of insomnia or heart failure was not adjusted for. Those with more severe comorbidities, like severe insomnia, tend to take more melatonin and supplements overall. They'll also have poorer health, higher risks of illness, hospitalization, and death. Finally, this seems very important and just common sense to me. The safety assessment of melatonin has already been widely studied. Its side effects are mild and temporary: headache, dizziness, nightmares, and stomach issues. This doesn't mean that new studies can't appear showing new side effects, but of course, those studies need to be well conducted. In fact, we have clinical trials in heart failure and melatonin for 24 weeks, where the consumption of 10 milligrams daily is not associated with serious side effects. No decline in heart, kidney, or metabolic function. Paradoxically, that's what's both interesting and sad. We have solid evidence about the beneficial role of melatonin on the cardiovascular system, and specifically on heart failure. The mechanisms aren't well known, and I'll explain them now. Actually, this 2025 systematic review and meta-analysis concludes the opposite. Melatonin, by improving psychological parameters and cardiac power, could be considered a novel treatment for heart failure. This concludes it. By valuing these headlines, we equate an observational study with decades of publications and many intervention studies on the cardioprotective effects of melatonin, effects that are based on the following physiological arguments. Melatonin is a mitochondrial antioxidant more potent than vitamin C or E, both of which are already powerful. Oxidative stress is the main driver of heart failure and many other pathologies. In fact, many times in advanced pathology, we encounter the paradox that there are higher endogenous levels of melatonin. How can this be? Well, it's very simple. Cells produce it in large amounts to counter the oxidative stress caused by the pathology. Typically, the melatonin 1 and melatonin 2 melatonin receptors become desensitized here, reducing their antioxidant effect over time. Second, melatonin modulates vitamin B and pro-inflammatory cytokines that worsen the disease. Third, it has anti-apoptotic effects on heart muscle cells. Fourth, it protects against ischemia reperfusion. In heart attack models, melatonin reduces injury size and improves heart recovery. Fifth, it has a nocturnal hypotensive effect which reduces the afterload on the heart, especially interesting in hypertensive patients. Here, you really need to be careful with melatonin because it can be and usually is necessary to adjust antihypertensive medication when using melatonin. Sixth, it improves endothelial function, functional class in heart failure patients, New York Heart Association, quality of life, and reduces NT-proBNP, a heart failure biomarker. What should I do, Borja? Should I stop or lower the dose? Is there another hidden danger? Is there going to be another study coming out tomorrow? One that will scare me. I'll explain it to you right away. Look, this is a reflection. Are these sensationalist approaches, which occur more often than we'd like, actually dangerous rather than harmless? Many people, scared, will just stick with the headline and will choose to go back to benzodiazepines to be able to fall asleep and stay asleep. In other words, they will go from taking something harmless like melatonin to using drugs that quickly cause dependence. They kill thousands of people each year, both directly and indirectly. These drugs double the risk of falls in adults over 65, increase the risk of hip fractures up to 4 times, worsen cognitive disorders, and are involved in traffic and workplace accidents. Most importantly, they quickly become addictive. On the other hand, avoiding a well-established active ingredient with proven effectiveness in sleep disorders. It leaves millions of people with insomnia vulnerable, but for some reason, they don't want to start taking hypnotic psychotropic drugs. And remember that insomnia by itself increases the risk of absolutely any non-communicable chronic disease you can imagine, among them, cardiovascular disease. But why does it suddenly seem like supplements are super dangerous and grabbing all the headlines? There's another controversy about heavy metals in protein supplements I want to clarify soon. Well, this is happening because there's a brutal smear campaign against nutritional supplements, although sometimes in very crude and misinformed ways, like the one we just saw. But Borja, are you saying this because you sell supplements? No, I don't make a living from that. Luckily, I do collaborate with companies that do sell them. However, if you follow me, you know that here, the relative importance given to supplements is just the right amount. We know this channel focuses on habits, and we give it our all, trying to clearly point out who supplements are for, who they aren't for, and to what extent they can help. And the verdict, as you can imagine, is that there is no evidence to suggest that supplementing with melatonin in usual safe doses poses any risk to cardiovascular health. which doesn't mean that it's not often misused or used without justification. You shouldn't stop taking it if it helps you sleep better, especially if it was prescribed by a professional. But this doesn't mean you should take it lightly or in high doses. In fact, one of the videos I want to make in the future is about the use of melatonin in high doses for anti-aging purposes, where, as I said, very high doses are commonly used, like 50 or even 100 mg. Are you interested in this video? Share in the comments. That's how poor communication is in small media outlets. If you have insomnia, I recommend this video to help you overcome it. See you next time. Big hug. Let's keep empowering.